Welcome everyone to this breakout session on addressing inequalities through health systems. My name is Richard Bergström. I'm Director General of FPA, representing the research-based pharmaceutical industry operating here in Europe. If you were here yesterday for the morning session, you heard my boss, my president, Chris Wiebacher, speak. Very pleased that you've joined us. We have about 55 minutes, or actually not more than that, for this session. We have to finish promptly just before 4 because Commissioner Borg will address the entire conference at 4 o'clock. I don't think I need to convince colleagues in the room why the European approach to welfare and social protection is one of the reasons why we're so proud of being Europeans. We can talk about food and wine and beautiful capitals and our cultures, but the social model is something unique that we all need to be caring for. When we see inequalities growing, that is surely a problem. And I and many think that this financial crisis that we're not through yet actually had made things worse, or there's a risk of making things worse. So we do need to think about the various tools to address inequalities that we have and tools for avoiding inequalities in the future, knowing that we will make necessary healthcare reform, we will innovate ourselves in the provision of healthcare and services. There will be new medicines, there will be new devices, there will be breakthroughs in the future. So how do we build a system to reduce inequalities or minimize inequalities? So it's sort of an obvious breakout session, I think, for this meeting. So I'm very pleased to introduce the three speakers. I will introduce all of them at one go here now in the beginning, and then we will listen to three presentations. They all have a few slides. I've said that speak maximum 15 minutes, so there's a chance for Q&A. Knowing what they're going to talk about, I'm sure that there will be discussions that have to be carried through after the session. Maybe not during Commissioner Borg's speech, but later if you hang around for longer in Vilnius or on the way to the airport. So we have three speakers. As I said, we're going to change the order compared to what's printed in the program. The first speaker is Aaron Reeves, who is a sociologist by training, PhD, Oxford University, who is going to set the context a little bit for this by expanding from just healthcare to social protection in general, the safety net, if you call it that, in Europe, which is everything, long-term care, rehabilitation, unemployment benefits, and so on, and reflect on what's happened in this crisis, what's happened to that. And also, as part of his research, is to look at the case for actually investing in social protection to promote growth. This is something that we keep hearing at this conference as well, that Europe needs to get back on its feet and grow the economy so that we can take care of our people. So Aaron's going to go first. He'll be followed by Joe de Kock, known to many of you. I used to introduce him as the head of the Belgian NHS. It's slightly more, well, NHS is not easy to understand, but the Belgian system, I live in Belgium, but it's quite complicated. But the one who's in top of it all is Joe de Kock. Very active in European policy setting. He's going to reflect on discussions that have been taking place in the high-level reflection process between ministries of health on cost-effective use of medicines. And Joe has also led a Chatham House-type roundtable with stakeholders looking at new access models for medicines, talking about differential prices in Europe. And you heard my president, Chris Wiebacher, say very clearly yesterday that this is something the industry is absolutely open to, certainly around the world, but why not in Europe, to address the inequalities, and particularly looking at new medicines in the pipeline. So that's what Joe de Kock is going to put forward, something quite interesting. And the last speaker is Dora Horvat from Hungary. You probably know that there's a lot of interesting things going on in Hungary. I think that the Minister of Health in Hungary, Miklos Zorska, who couldn't make it, he was invited to the main panel, is one of the thought leaders, I think, in strengthening health systems in Europe and developing high-performing health systems. Dora is one of the people doing the work in Hungary at the institute, National Institute, and she's been involved in another European high-level reflection process, which is the one on the cohesion policies and the structural funds and the cohesion funds that we have, and we're now getting ready, the EU is getting ready for the next 7-year budget. So It's a question of how is this money best spent in this area, so that we make strategic investments. And in making those investments, you can build systems that combat inequality. So Dora is going to talk about that. So you say it's quite a lot in 52 minutes, but we'll do as much as we can, and discussions will have to continue afterwards in other fora. So with that, I'd like to invite...
It's a great pleasure for me to be able to spend some time talking today about the research that we've been doing as part of our research group, and also to be part of this distinguished panel. Really, in the work I wanted to share with you just very briefly is some of the changes in budgetary spending. We hear a lot about austerity, but it's sometimes difficult to track and to see where in particular some of these budgetary changes are occurring, and to which groups are these budgetary changes affecting. And I want to try and use just briefly 2 case studies to do that, but also then, as Richard mentioned, to talk about issues around investment. But these are some colleagues, I just want to acknowledge them, although they're not here today. Their influence is very much written over the work that I'm going to be sharing with you today. So as I mentioned, there are 3 big questions that I'm interested in addressing in the few minutes that I have. What are the changes that we've seen to government spending? What impact are these changes having, particularly around social protection? What are they likely to have, perhaps, on health and health inequalities? And then, can we make arguments around investment in these areas? So firstly, the patterns of austerity and stimulus. Now, this is a heat map. There's a lot of data here, so I'm not going to expect you to kind of absorb it all. But very simply, along the bottom, we have listed the countries of Europe for those that we have data. And then in this kind of vertical axis, I suppose, we have the different sectors of government spending. This is adjusted for inflation, comparable data in terms of currencies. If there's a red square, it means between 2009 and 2011, there's been a reduction. If there's a blue square, it means there has been an increase in spending. And the countries are listed in order of the size of the reduction cumulative for total government spending. And I want to draw attention to 2. The first is health. The second is social protection. And both of these are important because during times of recession, we would usually expect them to rise. And this is because of something called automatic stabilizers. That is, when people are made unemployed, for example, they usually move, according to the social model that Richard outlined for us, they move from maybe perhaps providing in some sense for themselves to relying on state-provided welfare. So things like social protection rise during recessions. But actually, in some cases, we've seen declines in some countries in both of health and social protection, which means that these reductions are perhaps coming against the trend that we would have already expected. And this is interesting because it raises the question of, is healthcare austerity a choice? So when we compare the depth of the recession, which is along the x-axis here, versus the change in health spending, we can see that there's some variation across Europe. For instance, I'm from the UK, and we can see that the UK had a similar recession in terms of size, in terms of GDP, to the US, but pursued different paths. Greece is clearly an outlier here, but there is some variation around the decisions that governments have made. But we've heard a great deal about health and healthcare spending, and so I didn't want to spend too much time in that area, but really about social protection. So firstly, because we're here in Lithuania, I thought I'd spend just a moment or 2 reflecting on what's happened in Lithuania. And one of the interesting patterns is that we've seen some investment in health. The state have kind of filled in some of the gaps, but they have also reduced spending in some key areas. And actually across Europe, in terms of social protection, the largest reductions in spending have come to those with long-term sickness or disability, families of low income, and also, the unemployed. And so if we look at Lithuania specifically, this is unmet need. We've had a lot of discussion around this in the conference. So this is the trend in unmet need using 2007 as the baseline in Lithuania. And actually, unmet need has declined slightly across this period and maintained levels, which is, compared to some EU countries, a positive change. But when we look at severe material deprivation, that has begun to rise. And actually, we're going to see some quite large jumps here. So although that may look small, that's a 25% increase in the numbers of people that are reporting severe material deprivation. When we look at the number of people who are unable to keep their house warm, again, we're seeing a 50% rise. And then finally, for those who report they're unable to meet basic needs, a rather large jump. And these are concerning because although perhaps healthcare provision has been maintained, some of the social protections have been diminished, and this may have long-term impact to the health of populations as they experience poverty. But Lithuania is not the only country that has pursued this path, and the UK is another example of similar changes in social protection spending. And so we asked the question around health inequalities. So this is for the UK. We have the changes in local government spending, which is per person, along the y-axis here. And along the bottom, we have the level of premature mortality. It's a measure that's used in the UK to measure deprivation in an area or health inequities. And we can see that those regions with the most deprivation are also those regions that have experienced the largest reductions in social protection spending and government spending. And so because we already know that the level of social protection spending, the level of poverty in these regions is one of the compounding factors for the stability of health inequalities across these regions, we would expect those health inequalities to persist and very likely to widen. But also issues around homelessness. In the UK, even during the recession, with rising unemployment, homelessness was going down until the beginning of 2010, when there was a shift in policy towards reducing social protection spending. And actually, homelessness begins to rise at quite a rapid pace. Again, we know the evidence is already there to show the impact of homelessness and poverty on health and health inequalities, and this will only lead it to widen. And finally, issues around disability and sickness. And these are estimates from the UK government themselves, and they suggest that around 250,000 people in the UK will experience reductions in allowances of up to £4,000 per year. This is quite a substantial sum. And because 150,000 of those people are already living in poverty, this will only compound their situation, compound the financial strain that they're exposed to, and additionally push 50,000 people into or at risk of poverty among this group. So these trends are worrying because although we can invest in health, if we don't also supplement that by providing the social welfare support that people in poverty or at risk of poverty need, we may miss some key determinants of health and health inequalities in the future. And so to look at this, I wanted to discuss the issues around investment. And one of the key debates has been the debate around austerity, around whether we pursue that. And one of those arguments for austerity has been the debt crisis. That is, when debt rises, if it goes over a certain amount, the threshold's usually estimated to be around 90%, that the economic growth will slow, and then that becomes a major problem. This has recently become problematic because of some changes in some of the research that's been done in that area. The other major argument is around the fiscal multiplier. And so I'm going to kind of illustrate what this is, and some of you are probably aware of this debate. But basically, the fiscal multiplier is when a government spends an additional euro, or perhaps takes away a euro from their government, from their spending, what impact does that have on the economy? And if the fiscal multiplier is greater than 1, we see growth in the economy. Whereas if that fiscal multiplier is less than 1, actually austerity would be a good choice, because reducing spending actually isn't going to harm the economy, and it may create growth in some circumstances. The IMF originally estimated the fiscal multiplier to be 0.5. under those circumstances, it may have been a wise idea to pursue austerity in some situations. However, more recently, in fact, at the end of last year, they revised their estimate to say that we got that wrong, and it was actually a much greater fiscal multiplier, around 1.7. What my colleagues and I have done is we've tried to take this research and say, okay, well, that's total government spending, but if we break that out, if we look at the different sectors of spending, what is the impact of health or social protection or defence? And what we show here briefly, just in a kind of intuitive sense, is that those countries that have increased government spending the most across this kind of short time frame that we're talking about, around 2009, 2011, are also those countries that have seen the most rapid recovery. So this is what we found. Firstly, we found that our estimate of total government spending, which is that bottom line here, is very much in line with the IMF's estimates of around 1.7, 1.6 is ours, but the confidence intervals here overlap. But perhaps what is most important for our audience is that if we invest in health, education, or social protection, the fiscal multipliers, that is the returns to investment, are much greater than 1. In fact, they're probably around 4 at least. I mean, the confidence intervals are slightly wider in some cases than others, but they're certainly greater than 3. And so what this evidence suggests, at least, is that not only would these reductions in social protection spending and also in health spending hurt people on the ground in our populations, not only may they widen inequalities, but actually they may also hinder economic recovery. And so, in sum, in answer to those 3 questions, there's a range of research, some of which was presented by our colleague Marina Karanikolos yesterday, on the impact of the recession and austerity on health. And that is a growing body of research. And it's particularly fallen on the socially and economically vulnerable. And that is particularly true of social protection spending. And this type of austerity will exacerbate the impact of the recession by increasing the rates of poverty. But at the same time, investing in health and social protection will, as I said, not only perhaps support those populations, but increase economic growth in the short and medium term. Thank you very much.
Thank you, Aaron. Thank you very much indeed. So it takes a sociologist to explain to a layperson what economics are like. I think it was absolutely brilliant. And you also clearly reminded us about the fact that there are communicating vessels within the welfare model, both in terms of money and effects. And I think that's something we all that work primarily in healthcare or public health will have to consider. Makes it slightly more complicated though, but very good. Thank you very much for that.